accept a delivery.
How's it going?
Oh, you know, I've had better days. Lots of technical difficulties today. So
All good, all good.
I was telling all the viewers, I'm like, yeah, I was so amped up for opening up today, and then the phone system's down. So,
One of those days, eh?
yeah, not a good day for that, because I want to make contact with everyone and then try to get people to, you know, follow up and see how they're doing, and then can't do that. So technology, we're so bound by it.
Yeah. Oh, we're on now, so we're good.
Sorry? Oh yeah, now we're good. Now we're good. I don't know what happened there. So
I just saw Dr. Abdelkader, my brother. He's a chiropractor. He's joined.
hello, Dr. Abdelkader.
So I say a shout out. He's an inspiration for this paper. He's a very, very smart guy.
I'd like to give him a shout out.
I don't tell him that much, so he should record that.
I want to give him a shout out too and say I miss you. Yeah, I just miss you a lot. I wish I was. Wish we should get you on one day, Nader.
Oh man, you get your mind blown. My brother has definitely a lot of good research.
Let's do that if he's, you know, not too busy for us or anything like that.
Yeah, he'll cover a spot in his schedule.
As long as I don't have to pay him anything. Missing you too, brother, for sure, man. I miss that smile. I miss that positive energy. Dr. Abdelkader, very great chiro.
Yeah,
and someone I definitely value quite a bit, and we should actually go live and do some interdisciplinary work and and just show people how everyone can co-treat and how we can work together in a team setting.
Yeah.
He seems very excited by his responses, so I'm pretty jacked up. So,
all right.
We're going to be talking about complex systems versus linear regression to predict sports injuries.
That's correct.
And this is by Yehia Abdelkader. Maybe just introduce yourself briefly for those wonderful people who don't know. Interdisciplinary for the win, yes.
Well, I'm Yehia Abdelkader. I'm a physiotherapist in Toronto, Ontario. Excuse me. I've been practicing for the past 3 years. I graduated from University of Alberta, same university as Sunny Diol. And through my, I currently work at a private sports clinic, and I also work in neuroactive physiotherapy where we deal with neurological conditions. So I get to see like a mixed pot of cases, and it's pretty interesting. Keeps it interesting, and it leads me to do a lot of different research in a lot of different areas. And I stumbled upon this one here with my brother sent me actually. So I would like to talk about, it's not necessarily a research that we're going to show exercises for. It's just how we are reading research and how we're looking at research and how we're looking at, in particular, injury prevention. Mm-hmm. So, and why is that important? Injury prevention, if you can determine the risk factor associated with injury prevention, you will theoretically understand how to prevent the injuries and work on providing injury-free athletes, basically. And so I'm going to talk about today is I'm going to talk what's the system that we have used in the past, what is the new system that I've been reading about and is still fairly new, and why we should look at the second approach more closely as a way to determine injury prevention. All right, so what is the traditional way of analyzing injury prevention? The initial way is a linear progression way. So what we used to do, what we do use right now is actually a reductionist viewpoint. So basically we boil down an injury, boil it down to its units, and draw a straight linear line from that risk factor to the injury. So for example, so Sunny, if you can go into the next page. So this is the paper here, if you're interested, and you're gonna go to the next page after that. Excellent. So for example, this is a linear, just a picture of a linear regression. We're saying this amount of risk factor would cause this outcome right here. In the realm of sports, if we take, for example, ACL rupture, we can say that knee valgus, where basically the knee buckles in this way into the central line, is the risk factor, and that causes ACL rupture. We can say that because research has shown that. But what the linear progression is missing is, what about hip weakness? What about gender? What about hip angle? What about, how are these factors affecting each other and causing ACL ruptures? So, and that's where this will lead me to my next point. So the problem with linear progressions or linear regression lines is it assumes that the outcome is somehow related to the sum of the system's units. That is, that it can be predicted by looking at these direct relationships. But like we said, it is not really inclusive of the whole picture. So the proposition is the complex system. Now, the main difference between a complex system and a linear regression system is that complex system examines sports in terms of the relationship of the factors. So you see all these circles. So this is what a complex system analysis looks like. So you see the circles in the bottom there. It's the complex system. The main difference between that and the linear system is that it says that these factors in the bottom, they actually have a relationship within each other to give you that emerging pattern, which is the outcome that you're looking for, either injury prevention or increase in injury. So what is a complex system? Well, a complex system has to have 5 things, right? It has to be an open system, and I'll explain what each one of those 5 definitions more closely. Think of it has an open system. It has to have should be inherently non-linear. It should have a recursive loop. It should organize itself spontaneously, and it will have a level of uncertainty. So 5 things. Think of it as this way. A linear system is a machine. In order to get from point A to point B, you need to put X amount of fuel. It will produce X amount of energy, and it will get to point B. All right? It doesn't care about the weather outside. It doesn't care how you're feeling that day. It doesn't care about anxiety. Nothing. It just gets you there, point B, no problem. On the other hand, a complex system is a live organism. It needs to go to point B as well, but it has to consider the external factors, the internal factors, how the external factors and internal factors interact, how the internal factors within its system itself are interacting. For example, let's take jumper's knee, patellar tendinopathies. Patellar tendinopathies, 2 major risk factors associated with it is ankle range of motion. So the dorsal of the ankle doesn't move up as smoothly, so it's limited in the range of motion of the ankle. And training load, as in how high you can jump or how often you're jumping. So those are 2 risk factors. Now, limited ankle range of motion actually does not become a factor per se until the training load has increased substantially to a certain level, and then the ankle range of motion becomes a problem. But before that, it's negligible, right? So now you can see the importance of a complex system. Now we're talking about those are actually interacting very close together. All right. So what is an open system? Well, open system is exactly that. Is that interaction will lead you to the outcome, right? So how the ankle interacts with the training load, how the training load interacts with the weakness, of the weakness of the hips, weakness of the quads. It's how the environment within, whether it's internal or external, has interact with each other, and the different interaction will give you different outcome, right? So let's take another example. You want to get to point B, right? You can get to point B with your knee hurting and you're not that tired, or you can get to point B with your knee hurting and your hip weak, but your other knee is okay. Or you can get with the point B with no knee pain, but you're really tired, but you still get there. So it's open system means different interactions will still lead to the same outcome. Which leads me to the second point, is inherently nonlinear. So that system, you can see that it's not a straight arrow from point A to point B. the inputs are not proportional. So if you are tired this much, we'll give you an outcome measure that much, or vice versa. If you're tired this much, we'll give you a small outcome measure. It doesn't matter those circle size, which is how much influence those risk factors have on the outcome. It's non-proportional. Which leads me to the recursive loop. So this arrow that you see on the outside going from the end to back into the circles. So the outcome here, thank you, Sunny. So let's take it, for example, fatigue, right? So if you want to get to point B, if you have a lot less, so if you decrease your fatigue by 10%, you have decreased your knee pain by 50%. So the lack of decrease of pain will go back into the risk factor, and that will, for example, will cause less, if you have less knee pain, so you have more, for example, glute recruitment, so that in return will cause a decrease in knee pain. And if you have if we have proper activation, will cause less fatigue because you're efficiently contracting your muscle, so you're less fatigued, so that will cause less knee pain. And the circle kind of like, it's a loop, it's a feedback loop. The outcome, whether it's increase in pain or decrease in pain or increase in injury or decrease in injury, will be pumped back into the system, into that live organism, and will be considered as a risk factor, or as a determinant rather. So that's exactly what leads me to the fourth point of it's self-organizing. By itself, it takes care of itself. It adjusts according to the outcome, and it kind of just feeds itself. So that figure in front of you is what a complex system of analysis is when we're talking in regards to analyzing risk factors for injury risk factors, right? The group of variables in the bottom, like those circles that you see, they make up the web of determinants, which are composed of contributing units of different weights. So variable circles are darker, so those big, thick circles in the bottom, they affect the outcome more than the light, small circles on the side here, right? But that doesn't say they're not relevant, or the small ones are not relevant. Just say it affects it differently, or more or less. Those lines between the circles, those are the interaction between the determinants. So a dotted line is a weak connection. A thick line, like between those two thick circles, that's a strong connection, right? And those change because remember we talked about how it's an open system and it adjusts and spontaneously adjusts itself. So those change as we get different outcomes. All right, so let's apply this to an example or a few examples so we can get a better understanding of what it is. All right, so Sunny, you can go to the next page, next slide rather. So this is in relationship to an ACL injury. So this is a basketball player and the web material for ACL injury in basketball athletes. All right, so you can see here that the main determinants in the bottom, given that they're in the thick circles, is is dynamic knee valgus. So remember we talked about how the knee bends inwards. So a risk factor is knee valgus. Another risk factor is also hip weakness. And another risk factor for basketball players in ACL injury is unanticipated environmental events. Obviously, because you don't know what the team is doing, the opposing team is doing. It changes. It doesn't just. It's not practiced. It's not choreographed. That's what I'm trying to say. So you can see those are the three main factors, and you see how they interact with each other. However, dynamic knee valgus, the bending of the knee in, is actually affected by other factors. They're affected by fatigue, hip muscle strength, neuromuscular control, anatomical alignment of the foot, training load, right? So this is ACL in athletes, but that athlete is a basketball player, right? And you can see age, sex, you can see all of different other determinants that would lead you to certain outcomes, and then the outcomes will go back in. And then now we can get a better idea, a more wholesome idea of how these what factors affect ACL injuries, and we'll be able to control them a little bit more so we can prevent them. Now, it gets a little bit more interesting. So if you go to the next page, Sunny, please. Now we're looking at ACL injuries in athletes, but then now that athletes is a ballet dancer, now everything changes. Although we're talking about the same outcome, we have reached the same outcome, but we have different determinants or different risk factors or variables in the body. Because a ballet dancer is, because nature of the sport, it's more choreographed. So the unanticipated movements from the opposing team is kind of negligible in this sense, right? So what we're seeing is the main factors for here is the presence of knee valgus, the bending of the knees, or hip weakness, and other undetermined factors. Fatigue, attention level, anxiety, and unidentified variables all are concern for ballet dancers in particular with ACL injury. Now, what we've been applying to the basketball player is not necessarily identical to what we're applying to the ballet dancer, because even though the outcome is the same, because it's different variables affect that. And that's what the beauty of complex system is introduction of, or not introduction, rather, as opening our eyes to true nature of what hurts or what risks are associated with that athlete or with that sport, so we can address it appropriately. And if you're watching any of my other sessions, you'll notice that I'm all about understanding the whole picture. I'm steering away from addressing local injuries. I'm looking at understanding bigger whole pictures, and that's the main idea of this paper. And this is the reason why I thought this was very interesting. I'm going to show you another paper, and you'll see how further complex it's going to get. And so if you can switch on to the next paper. So before we move on, do you have any questions in this segment? I'm going to wait for like 30 seconds. If nothing, we'll just do a bigger question Q&A then. Sam, do you have any questions?
No, I find this fascinating though, like in terms of the complex systems, and it makes sense though how you have different factors and how they intermingle. It's very rarely, exactly. That's why it's always difficult to look at research that says, glute med strength affects this much, but there's so many other factors that play other than glute med strength. Is it that's causing it? Is it a back issue? Is it all this other stuff? So I think it's really
exactly
cool to see how it's made.
And how they interact with each other is another big thing.
Yeah, that's really neat to see. Yeah. And the strength of it, it would, as a researcher, it would be a nightmare to come up with those, but I think it's huge. You can, just like how you saw the transition between the athletes, right? Between the ballet dancer and basketball. There's sports that have very internal environments like ballet, or external being like another team hitting you or something like that. You don't have any control. There, you're going to get blown out, you're going to get blown out. Yeah, so that's cool. I found it very interesting for sure.
Yeah. All right, so let's move on to the next page here. So I'm not really going to dwell into what they found. I'm more interested in the results section, which is for all physios or clinicians. That's the part we skip the most, but this time I'm going to delve into it a little bit more. So this paper is looking between an association between of hip and foot fractures with patellar tendinopathies or jumper's knee in athletes. So basically, I'm not going to discuss a lot about the paper, but the aim of this is they investigated. They use a complex system, this is called the CART analysis, and this one here, to measure the different variables that affect foot and ankle in patellar tendinopathies or jumper's knee. The variables that they used are shank forefoot alignment, SFA, which is your shins and your foot, how they align. Because sometimes the foot is right here, and your tibia, your shins are right here, and how they align. So if you're looking at the back, I'm just going to give you an example. If you're looking at it from the back, how they align this way, that way, whatever the alignment is, how that aligns. Ankle dorsiflexion, as in ankle range of motion. Passive hip internal and external rotation, how much rotation you have in your hip. External rotation torque, and different variables. It doesn't really matter, but just different variables all connected together. So I'm going to read you the results first, and I'm going to show you what we're talking about. So the classification identified that hip internal rotation and SFA, which is the shank forefoot alignment, hip external rotation torque, are predictors of knee pain. Passive internal rotation was selected as a cutoff of 40.8 degrees. So internal rotation was 40.8. In individual with lower values of passive hip internal rotation, SFA was the second predictor. So if you have lower degrees in your internal rotation, then they're going to take another determinant, and then with a cutoff of 16.9 and a hip external rotation torque as a third predictor. So basically, Sonny, can I see that next slide, please?
Yeah.
So this is what they're looking at. So you can see that here, like hip internal rotation smaller or equal to 40.7, and hip internal rotation, external rotation more than 40.7. And then if you are less than or equal, then we took the SFA, or if you're more than, you take the passive hip internal rotation. So you can read the paper. It's a very interesting paper, but I just want to show you, like, it's not hip internal rotation more or less than 40 degrees. It's if you're 40, less than 40, we take another determinant, and if you're more than 40, we take another determinant, and from that we take more determinant. So that would lead us to the next page. And so this is basically the creme de la creme of the results. So you can see here, I can't really see that far, that people with patellar pain, you have the hip internal rotation. If you have hip internal rotation less than 40.7, and you have an SFA angle of 16, and you have hip external rotation, you have a risk factor of getting patellar pain. But you also have a second row. In the second row, you're going to see different variables that will give you the same outcome. And the third row, you're going to see that variable alone can give you that outcome. And so is applicable to without knee pain. So the risk factor decreases if you of knee pain decreases if you have these factors in the bottom. And that's what a complex system does. It looks at the whole picture. And now it is tedious, and it is painful to I won't say painful, sorry. It is tedious, and it's still fairly new, and it's still pushing the limits of research. But I find it very interesting, and it took me a while to read the first paper. It was a very hard read, but after I read it a couple of times, I was like, oh, this actually makes a lot of sense, and I was able to understand that paper no problem. And that's all I got for you folks. Thanks for tuning in.
I'm just going to adjust the height of this here. All right. So any questions from anybody? I think that's very interesting. It's things that...
Yeah. Something new, like something like keep an eye out when you're reading your paper. Look at the results section. Like, don't skip that part. See how we're reading the results. Like, are we including all the determinants so we can apply these findings appropriately to the clientele that we are seeing. So it's appropriate to the type of athlete or individual that we are seeing.
Mm-hmm. Exactly. Yeah, you always have different athletes. Like I see certain ones, and you have some that have certain factors, some that don't have other factors, and it's important to know the difference between. Because it's going to be interesting because I'm actually looking at patellar tendonitis, tendinopathies tomorrow with a great Olympic lifting coach here in Edmonton. So
nice.
You can draw some relations from that sport into others, but it's tough because it's a very specific sport. You know what you're doing the whole time, and like there's no blowout, so to speak, right? Like there's no, you're gonna trip and fall or get hit or something. So it's very controlled, the environment. So it's interesting to see what happens when there's not much control and what could lead to.
Absolutely. And so you're going to be looking at a different set of variables that pertain to your sport. It'll be interesting, like, to see if you're a weightlifter yourself, like, just if you think off the top of your head, like 3 different things you feel are determinants in Olympic weightlifting, you can start incorporating that in your actual clinical practice and see how that affects it. And we include it in our subjective, which in my opinion is also very very overlooked. Like we don't spend enough time, in my opinion, on subjective assessment. Like we need to ask more questions that pertain just away from the injury. We need to ask about like other factors going on. So if you're going to inject those right now into our subjective and get used to seeing a pattern,
Yeah.
excuse me, you'll hopefully see better outcomes for your patients. Yeah, so if you guys have questions, we'll hang out here for a couple of minutes, and be nice, short, and sweet. Hopefully, Sunny gets his phone system back and running.
I sure hope so. I don't know. I was pretty angry with my first call that I made.
Yeah.
They're like, we don't know what to tell you. I'm like, I don't know either. Very nicely put. Yes. I like that. I like the complex systems and how it's arranged. Like it looks, to me, very excited as in the research field and figuring out, because I always look at research and I'm like, you know what? There's only these two factors. They don't consider anything else. It's no fault of their own.
Yeah. And there is a time and place for that research. For example, when they prove when they draw a correlation between smoking and lung cancer, right? But that's like that's important. I didn't want to delve into too much detail, but a linear progression is appropriate when the outcome is very close to the risk factor. Mm-hmm. So when I gave the example of knee valgus and ACL rupture, knee valgus is on the inside of the knee and ACL is inside of the knee. So we can use a linear regression to determine that because they're so close together. But to say ankle range of motion and knee pain, then we're kind of like looking at the different joints and they're so far away, we can't really draw a straight line. We have to like consider other factors outside. So which makes sense, right? Like if you're close to the joint of injury of the joint on concern, it's easy to draw the correlation with something close to it.
Yeah.
So there is a time and place. So it's like, I'm not trying to say let's throw out linear regression. All I'm trying to say is like, hey, this is a new way. Let's start including something like that in our research for all the researchers out there.
Yeah, I think that's a great point. I mean, I think about a tendinopathy and the different factors, and there's quite a few from like one sport, and then
exactly.
Yeah.
It's endless.
So this is going to help my presentation tomorrow.
There you go, man. You're welcome.
No, I didn't say thank you.
Oh, you don't need to. Your eyes said it.
I know. I'm just kidding. I'm trying to be cool, but I try. Yeah, we can hold on for another minute or two, and then if not, you guys can direct message us or Yehia and ask more questions if you have any questions. While we wait for questions, I wanted to thank you again, Yehia, for coming in.
My pleasure, sir. My pleasure.
A lot of time to do these things, so I appreciate your time.
Absolutely.
Yeah, it means the world to me to have you do this with me, and it even means even more because when I have people come in, I don't got to do nothing.
There you go, man.
I just learn. That's just a free lecture for me, and I'm like, sweet. Like Judy, our amazing professor Judy, she's like, oh, like what should I do? I'm like, this is your rodeo. This is your rodeo. You do it all. I'll grab the bands and do the exercises. So I'm excited for like all the guests.
When is she coming on?
She's coming on Thursday.
Nice.
So brush up on the shoulder, and it's meant for everybody. So whether you're a physio, you're an athlete that has an injury, whatever job you have, whatever occupation, this is meant, all meant to understand at a broad level, and then like you can kind of use some of these things in your own detail. Like for the people who might be doing sports and maybe not medical field, now you know there's multiple risk factors, and all of those risk factors have some sort of relationship between them. For the physio is listening, or the new graduates or students, now it gives you future direction for possible research. And like when you look at things, you know, think that, you know, there could be other like limitations of the studies,
Yeah.
that's going to be all highlighted. So you can look at it from any perspective, right? So I think it's pretty cool. I think it's really cool. We have a question on here. Okay, a booking.
There you go.
One of the Zoom attendees wants to book, so yeah.
Well, if you have no questions, well, thanks for having me on, Sunny.
No problemo.
All right,
Thanks for
sir.
coming. Yeah, appreciate it as
Yeah.
always.
Take care, sir.
Peace out.
Okay.